Good morning, everyone. Thank you for joining me at another Tuesday Tips. My name is Sharon Johnson. I am hosting our segment today. Our topic for discussion is Your Feedback Matters. So, all of us at some point in time have encountered a survey from a medical facility, a physician practice. So, we've seen or received these surveys are asking for your feedback, asking for your insights and how things have and what things have happened during that interaction. So I'd like to expand and share a few tips in terms of what that means and the value of a patient and staff feedback. I also want to call out and note that for us that are healthcare workers, we have a dual role. I do believe that in terms of survey, not only are we providing patient care or assisting providing patient care for those of us that are supporting our clinicians, and then also we are patients. We certainly go to physician practices, utilize hospitals, emergency rooms, urgent cares, rehabilitation facilities, and the like. And so we are what I call dual role in the sense that we provide patient care services and support patient care services for those that have administrative roles, and also we go and utilize and access the services within the healthcare organizations. So keep that in mind as I go through some of the points that we'll be discussing today. So, your feedback matters. It explores the immense value of patient and staff feedback and how healthcare organizations can leverage these perspectives to enhance their services. So, we're going to start out with the patient perspective, a window into care experience. And remember, physician practices vary in size and scope. No one is a one size fits all, and so keep that in mind as well. Facilities also vary in size and scope and depending on where they are from a health system perspective as part of that network health system, and also demographic. So we want to consider, the demographic in terms of population that we are surveying, whether that's rural or urban setting. So keep that in mind as well. So let's dive into what the patient perspective is. So patients are the heart of healthcare, and their feedback provides a unique and essential perspective on the quality of care delivered. Their experiences offer insights that may not be apparent from clinical data alone. So here's why patient feedback is crucial. So one is that identifying service gaps. So those service gaps are what patients can highlight areas where their needs or expectations are not being met. They reveal opportunities for improvement that may not be visible to healthcare providers. And so that gap calls out any workflow inefficiencies, redundancies, maybe some bottlenecks in certain areas of the practice. That could be on the front end, perhaps in the middle where there's rooming and some diagnostic testing if you provide that on site. And also, lastly, when the patient is checking out and scheduling follow-up or anything that would require from a back-end billing perspective. The second is improving communication. So feedback often reveals communication, preferences, and concerns the patient may have, and so that it shows the healthcare providers can better tailor their services to meet individual needs, improving overall patient satisfaction. Again, we go back to, there's not a one size fits all, but to know what your patient preferences are helps with that communication, whether that is an in-face communication, using the patient portal as a way of communicating, or that could also be mail in terms of, again, another type of communication. The other is enhancing patient-centered care. So understanding patients' preferences and concerns also tailors, scheduling what is preferential for the patients to schedule? Do they use their patient portal to schedule? Do they call the practice to schedule their appointments? So again, these are things that would help as well. Then we have the build in trust and loyalty. So when patients see their feedback being acted upon, it fosters trust in the practice as well as the healthcare system that can lead to increased loyalty and positive word of mouth for referrals. And I do think that is impactful because word of mouth is still a way to um, get patients to be able to go to your physician's practice because you really like the way how the clinician is taking care of you, how the practice is warm and welcoming, things are running smoothly. And so that matters in terms of a patient experience who has an interaction or has a conversation with their friends or family or anyone that they may come across, and they would refer your practice because they were so they trust and have built loyalty over time. They know that their practice has been there for them and has been really providing excellent service. So and also that building of trust and loyalty is going to vary in terms of your practice size and scope. But I do think the core of what that means from a patient perspective is that it has met not only their preferences but also their checklist and their relationship that they've built with the clinicians in their practice. Similarly, it would also be in the same vein with other medical facilities that they've felt the interaction has been to a satisfaction in the way of how they've been taken care of. So I think that's the perspective that we need to look into as far as building trust and loyalty. Lastly is tracking progress. So tracking progress is very important in myriad of ways. Regular patient feedback allows organizations to monitor the impact of changes and improvements over time. So changes aren't happening overnight. These are over time, and it also ensures continuous process improvement. So you can evaluate what is working, what is not working. We might have to pivot because certain things are not working at this present time. And so it's something that we might have to pivot for, again, a myriad of reasons for what they would be. So that is from the patient perspective. Now let's look at the staff perspective. So this is the insight from inside, right? These are our staff workers that are in physician practice, hospital, urgent care, other facilities that our staff is involved in patient care, utilizing the equipment and digital tools that is part of their daily task or jobs that they have to perform in our organizations. So let's take a look at why that is important. Healthcare staff, from nurses and physicians to administrative personnel to ancillary medical technicians, possess intimate knowledge of day-to-day operations and challenges. Their feedback is invaluable for many reasons. These are your frontline folks. These are the folks, again, as I said, they interact with your patient. They utilize and access the equipment and digital tools. They are the folks that are working on the workflows that have been created in order to provide that patient care. And lastly, these are also the same folks that support the organization in its initiatives and goals in taking care of the patients. So what they do in terms of the staff feedback, once we evaluate that and receive it, it identifies 5 things. Identifies operational inefficiencies. Staff can pinpoint bottlenecks, redundancies, and workflow inefficiencies that may not be apparent to management. Improving resource allocation. Staff feedback can help leaders understand where resources are not needed, leading to a more effective allocation and utilization. We are all experiencing staffing shortages and have to come in a very innovative way of approaching staffing, in hiring processes, in looking and evaluating what we have in our workplace. What are some things that are automated that we can do that? And again, it's not replacing the workforce, it's more of what kind of automation can be done that would assist reducing the administrative burden for your workforce. The other is enhancing team dynamics, right? So regular feedback can reveal team communication or collaboration issues, allowing for targeted interventions to improve workplace culture. So again, it's a way for in awareness of how teams communicate. What are some things that we can do better? What are some things that would improve our collaboration and innovation as a team? Number four, it's driving innovation, as I alluded to that. Staff can often have creative ideas for improving processes or patient care, fostering a culture of innovation from within. Again, as I said earlier, these are your frontline folks. They are the ones that are taking care of your patients, utilizing the equipment and digital tools, and also enacting upon the workflows that have been created that over time potentially could be inefficient. There might be some redundancy and bottlenecks. And so because they are in that day-to-day operation, they see it every day and they live it every day, they also are the ones that are coming up with some creative ideas that could help and improve their workflow for efficiency and running things smoothly. Lastly, it boosts morale and retention. So when staff feel their voices are heard and valued, job satisfaction can significantly improve and reduce turnover. It also is good to have a conversation about the results, the data behind the results and why, the results are such in terms of the feedback survey. So it's important to talk to staff about what that data means, how that data applies to their day-to-day work in terms of the results and percentage in terms of their satisfaction with their job. It helps to know that. So our third tip today is how can we implement effective feedback systems? So to truly harness the power of patient-staff feedback, healthcare organizations should consider the following strategies. So diverse feedback channels. You should have various ways of collecting or giving out surveys. So one of the ways that you can do that is surveys, focus groups, suggestion box, digital platforms. For the myriad of feedback mechanisms, it captures a wide range of perspectives. Second, regular and timely collection. It shouldn't be where it's we're doing this survey as a one and done. It should be where it's somewhat cyclical in the way that, it could be part of an initiative and you're wanting to see what initial survey and getting a baseline information for that survey. But I would recommend that you have a follow-up from that baseline survey. Over time, things change. People's perspectives and lens change as, the results of that initial baseline survey was given and what were some of the insights at the time and where were staff's lens about their particular work and environment and the culture that they're living in. So I would suggest that you would have another time to get a consistent schedule for gathering feedback again. So this ensures current and relevant insights. Third is anonymous insights. Develop systems to analyze feedback and provide opportunities to have anonymous feedback to encourage honest and open communication, especially for sensitive topics. Then you want to have actionable insights. You want to develop the system that analyzes the feedback, extract actionable insights to inform decision-making and improvement initiatives. So, extending out the survey, there is a timetable for that survey. You're getting your baseline foundation, and from that, you're going to seek out and analyze that. What are some of the actionable items that can be done, right? Then you want to prioritize that. based on your organization, based on the goals. What are these actionable items based from the survey results that we can do? And again, this isn't going to be something where it's an immediate change, but I would say that you would look at the results of that survey and how it can be implemented, the actions that can be done, that are feasibly done, that staff can also see that changes are being made based on the survey or their voice that they've lent about the organization. So closing the feedback loop is important. You want to communicate to patients and staff how their feedback is being used to drive changes, reinforcing the value of their input. And lastly, integration with quality improvement. So incorporating feedback insights into broader quality improvement initiatives, ensuring that patient and staff perspectives are central to the organizational strategy. Now, as in anything with feedback surveys, there are certainly challenges that comes with that, and we want to look at how we can overcome these challenges. So while the value of feedback is clear, implementation can be challenging. And again, as I mentioned earlier, each facility has a differing size and scope, differing patient population. Some may be in a rural area, the others might be in an urban setting. So, that variety in itself can also be challenging in the way that how you would disseminate that information about feedback. So how you collect and how you gather that, you might want to think about, again, the channels based on your environment and population and what is available for patient and staff. Is it a digital tool? Is it a survey paper? Is it a focus group? Again, looking at the various feedback channels. In that, some patients may also be reluctant to provide honest feedback. So, for fear that they would impact their care, staff may also be hesitant to do that due to concerns about job security. And, on the extreme side of things is possible retaliation, and that's not something that you would want to make sure that that's something you alleviate when you're sending staff feedback. Another is addressing their concerns through clear communication about the purpose and anonymity of feedback process is crucial. So additionally, healthcare organizations must be prepared to handle potentially negative feedback constructively, viewing it as an opportunity for growth rather than criticism. Because in that lens, what are some of the things that we could grow and do better, rather than you're being seeing it as a penalty or a negative criticism to your organization. So in closing, the voices of patients and staff are very powerful. Catalyst for positive change in healthcare. You want to actively seek and value and act upon their feedback. Healthcare organizations can create culture of continuous improvement that benefits all stakeholders, particularly where, as I want to emphasize, as healthcare workers, we have a dual role in that we are providing patient care and supporting patient care, but we're also accessing patient care as well. We utilize healthcare facilities, physician practices in order to improve our healthcare, and so we seek clinicians to help us maintain good health. We also seek hospitals, emergency departments, urgent care centers, skilled care facilities, long-term care facilities, when we have needs, emergent needs that require attention, medical attention. The other is also making sure that you're still driving that healthcare quality. You're making sure that you're strategically using the feedback not just as an essential, valuable tool, but it's also success in your organization. Again, it's not an overnight success, but it's something that over time, through continuous feedback gathering in a consistent schedule, you'll be able to see as you're tracking your progress, what is working and what is not working. And lastly, by tapping into these rich resources of insight, healthcare providers as well as organizations can navigate through the complex landscape of taking care of their patients and ultimately delivering better care that is suitable for their physician practice. Again, just to reiterate that no one is the same size and scope, and also outcomes for the communities they serve. I go back to the patient population and the demographics, whether that is rural or in an urban setting. So I hope that these tips will be helpful as you engage in an employee and staff feedback, that this is something that is not a one and done initiative, but you see it as something that would help you to grow and improve over time. Well, that's it for us, folks. Um, Please let me know if there's anything that I can help you in this area. Feel free to put in a comment, and look forward to another Tuesday Tips.